Hi everyone, my name's Katie from San Francisco Health Insurance Agency, and today I'm going to show you how to sign up for a Part D prescription drug plan on Medicare.gov. More than likely, you just signed up for a Medicare supplement plan, a Plan G, a Plan F, through a private carrier like AARP UHC, Blue Shield, Anthem, HealthNet, etc. So you have the Medicare supplement plan on one hand, which is purely Medicare medical expenses. And then you need a supplemental drug plan on top of that as well. Together, you'll have the best coverage moving into a full Medicare transition. Now, a Part D, unlike the supplement plan, is administered through Medicare.gov, and so that's where we'll go today. Keep in mind it is different than Social Security, so once you get your Medicare number, you'll be able to create an account on Medicare.gov. Before we start the video, I just want to say that our office, I myself, we do not offer or sell Part D prescription drug plans, and we don't have any information about plans specific to your area. Any information that we provide today is purely educational, so please contact Medicare.gov or 1-800-MEDICARE to get information about all of your options. So the first place that we'll go is Medicare.gov. This is the landing page. Assuming you haven't set an account up yet, you're going to go to Login, and you're going to click Create an Account. You're going to enter your Medicare number. You're going to enter the Part A coverage effective start date, and then you are going to answer a couple other questions where Medicare verifies who you are. And then you're going to create a username and password, and you're going to sign back in here. For example, in educational purposes, Steve gave me his consent and written permission to go into his account to show you what it would look like when you're signing up. So this is your Medicare dashboard. You'll see when your Part A and your Part B coverage start dates. You'll see if you ever need to pay your premium or you lose your Medicare card, etc. It's a very handy portal. To look at the drug plans and to sign up for a drug plan, you're going to click View My Plans. Then you're going to click Preview 2023 Plans. Now, right now, it's a special time. So if you're new to Medicare and it's the middle of the year or something like that, pay attention to this because it's going to say current drug plans for 2020, whatever year you're in. Right now, we are at the cusp of open enrollment, which is October 15th to December 7th. And so that means that because Steve is already enrolled in Medicare, he has the option to change his plan for January 1st, and therefore they're allowing us to see the 2023 plans. So we're going to get an estimate. But if you're new to Medicare, you should sign up. If it's the end of 2022, you'll look at 2022 plans. If it's 2023, you'll look at 2023 plans. This is kind of a quasi in between, but I'll show you what I'm talking about. So we're going to click 2023 plans. And then it's going to show us all of our current plans. So right now, 2022 plan, Steve's already enrolled. If you scroll down, you're going to click Find Plans Now. You're going to click your zip code wherever you are. And this is key. So if it's November or December of 2022, click 2022. You're only going to see the estimate for November and December, the rest of the year. And if you are turning 65 in November and December and starting your supplement plan, you will enroll in the 2022 drug plan. If your birthday is for January 1st, 2023, you're going to click 2023, and we're going to click Find Drug Plan Part D and start. Yes, we do want to see our drug costs while we search. And when you now enter just all of the drugs that you're going to take, so for example, atorvastatin, add drug. They're going to ask for what type of dosage you take. You take 20 milligrams once a day. I'm going to add that to my drug. I'm going to add another drug. We're going to do losartan. Add drug. Select your dosage, your quantity, once a day. Add to my drug list. And then you finish adding whichever drugs that you need. triamcinolone. This is like a cream. We're going to get a tube once every month. So once you're done adding drugs, you click Done Adding Drugs. And now you're going to click your pharmacies. So if you live in the North Bay, then you're going to pick at least 4 pharmacies. Now this is important. Even if you're loyal to the CVS down the road, I encourage you to shop at a Safeway, a Rite Aid, a CVS, a Walgreens, any other pharmacy in the area, because sometimes the drugs are a lot cheaper at one pharmacy than the other. And so for the sake of this exercise, we're going to click at least 5 pharmacies, and there's mail order too. And keep in mind that a Walgreens in one area is going to be the same as a Walgreens in San Francisco. So Walgreens prices are the same with every other pharmacy. You don't have to find the exact one that you would go to find the prices. Once you're done adding your pharmacies, you're going to click Done on the bottom right. And right now, we are viewing 2023 plans. So this is going to be a holistic preview from January 2023 to December 2023 and what that estimate would look like. So this is Steve's current plan. If you're new to Medicare, you won't have a plan up here. It'll just start you on this page. On the top left, you'll see that there's 26 different drug plans offered and that they are sorted by the lowest drug and premium cost, which is this line item here. The way that Medicare.gov works is it takes all your drugs, it takes the pharmacies that you'd go to, and it runs them against the formularies of the 26 drug plans, and it shoots out which plan would be the most cost-effective for you. It factors in your drug cost, your monthly premium. This yearly drug and premium cost includes how much you would pay in the premium. It includes if you hit your deductible, and it includes how much you would pay at the pharmacy. So you'll see that the estimation for 12 months, these are relatively cheap drugs, would be $130 for the whole year. And as you keep scrolling down, even if the monthly premium is lower, the drug and premium cost is going to keep going up. So now we're at $260, $265, $339, $481. So this is how you shop for the drug plan. Now, a lot of people ask, my drugs now are cheap, or I don't take any drugs right now. How does that work? And our answer to all of our clients is you just don't really know. We're not experts in Part Ds, but to the best of our knowledge, you can't figure out how an expensive drug would be covered because you don't know what type of drug you're going to be taking in 6 months if you get a diagnosis with really expensive drugs. So right now you do the best with what you can, and unfortunately there's no, this plan you're going to pay more money so you'll have better coverage. To our knowledge, and we don't sell Part Ds, we don't think it works like that. So you can consult someone who is certified to sell Part Ds. This is just an educational webinar about how to sign up through Medicare.gov. So because this is the most affordable one, we're going to click Plan Details. And you'll see that 3 of your 3 drugs are covered. And they're saying that you should be estimating to pay $8.30 a month. And then you're going to be paying $30 for your drugs every time that you pick them up from the pharmacy. If you scroll down, you'll see which pharmacies are in network. Most of them are, except Rite Aid. If you scroll a little bit more, you'll see that all of these drugs are really cheap, so $0 or $30. But at Rite Aid, it's going to be a lot more expensive. So these are the drug costs for the entire year, the 12 months. And if you go to Rite Aid, it'll cost you $38 or $96 for certain drugs for the entire year. But a lot of them are free. So that's why I wanted you to shop at different pharmacies so you could see the price difference. And then if you scroll down even more, you'll see how much you would pay every month if you went to pick up your prescriptions. So it's pretty straightforward. There would be an enroll button, a bright green enroll button here when you're ready to enroll. So if you're a January 1st person and for whatever reason you're seeing this video in the next 2 days, then you would have to wait until October 15th to enroll. But if you are a November person signing up for a Part D and you wanted to see what your drug cost would be for this year, for 2022, for the rest of the year, then you're going to go up to the top left and make sure it says 2022 plans. So it's still saying, I think the same plan is the most affordable. You'll see the premium changes the year later. You're going to click Plan Details. You're going to notice that the costs for the rest of the year are only estimating November and December. So they're saying that you would pay, $1.76 for November and December if you were to pick up your drugs and sign up now. This is how you sign up for a Part D on Medicare.gov, purely educational. Let us know if you have any questions regarding it. Our contact information will be in the video description below. Thanks so much.